Are you experiencing chronic illness or new symptoms after having an operation with implants? Then today I've got your back because I'm speaking with a renowned environmental engineer and functional diagnostic nutritionist, Dr. Sharon Surita, to discuss the effects of Asia syndrome. Hello and welcome to Beyond Diagnosis, a podcast to raise your awareness, decisions, and voice for alternative practices so you can take back control of your health. I'm Rita De Michele, your host, a mindset and empowerment coach, and the founder of the ONUS platform. Join me each week so you can create the health of your dreams. Welcome, Dr. Sharon.
Thank you so much for having me today, Rita.
Oh, it's a pleasure. This is really, I think, so new for so many people. You you specialize in detoxification. You also, around toxins, mold, chemicals, but you are very passionate around implants, specifically the mesh implants. And for anybody listening and watching, if they don't understand what that kind of mesh implant means, is if you have a hernia and they put a mesh implant in there to secure so it doesn't burst again, basically, in simple terms.
hmm
Can you tell us a little bit about that? And I believe you have a personal story around it.
Yes, I do. Absolutely. I'd love to share this story with you and your audience because it's one thing that pivoted my whole life. I did a 180-degree transition from what I thought was going to be my career, my retirement location. I was an environmental engineer full time, and that's where I developed a specialty in environmental toxicants. So looking at exposures, chemical exposures primarily, but in the air, water quality, and things like that from an environmental engineer's perspective. So designing structures, designing stormwater systems, designing even landfill treatment systems to minimize gas toxicity from methane from the landfills, a lot of other toxic and noxious odors
Mhm.
from landfills, and then the water quality, which is a big piece in all of our human health. But going into 2019, when I had my own hernia repair surgery, it was supposed to be a biosynthetic, no, not a biosynthetic, it was a biologic mesh because I had already heard about lawsuits for the polypropylene mesh, which is the gold standard. That's the one that they use in probably over 90% of hernia repairs because it reinforces that structural defect in the abdomen. Yes, absolutely, but it's plastic, right? And we know how toxic plastic is in the environment, but we're implanting this in the human body. So you can think about that. And
Wow.
I already knew I didn't want the polypropylene, and I fought for biologic mesh, but what I was implanted with was a hybrid. So it still had plastic in it, a small percentage, but enough to trigger that inflammatory response, which you called out as Asia syndrome. And that is an autoinflammatory, autoimmune syndrome that's induced by any adjuvant. That is what Asia stands for. And that's what I experienced. That's what people with breast implants tend to experience. And, it's becoming more not a formal diagnosis, but doctors are understanding that it really is an issue that can be happening with people who are having these seemingly benign surgeries.
You know, I'm actually really surprised because like yourself, I had hernia operation and I had mesh put in. I was never told or educated what that mesh was. In actual fact, when I had the operation, no one even told me that I was going to have mesh. They
Mhm.
just said that I was having a hernia operation. It was only once after the operation they said, "Oh, we've added a mesh, and we put a mesh on the other side just in case that one bursts too."
Mm.
But I was never told. I was never educated about what it was, and when he said mesh, naturally my mind just went, "Oh, it must be some surgical grade." I just naturally
Right.
thought like a super fine kind of stainless steely thing, that would be, surgically appropriate for putting inside a body, except but now you're telling me it's plastic.
Mm-hmm.
See,
It
that
is.
I had it in 1999, and now, just this second, I found out that it's plastic.
Yeah, yeah, and some of them are made out of different forms of plastic. So we know polypropylene is the main one that I mentioned. The Phasix ST, which is now becoming more commonly used because it is that hybrid mesh, and it still holds most of that structural integrity, at least for the first 3 to 6 months. That one is supposed to degrade over a 6 month period, but it's been seen, it's been known to not degrade at all. I've met numerous people who have had explant surgeries years later, and that has not even changed in constitution and size. It's still there. It's causing an inflammatory response. So, of course, there's granulomas observed when they have the explant, lots of inflammation, and you can see the pathology reports that are showing it's still persist like years and years after it's persisting that inflammatory response, which is what can cause chronic disease or chronic disorders.
So they're actually noting that there is a high inflammatory response on their blood work, and they're ruling out everything else, and they can pinpoint it down to the mesh.
Right. And it can be very long time before they can understand, they can come to the understanding because as you had your surgery, you said in 99 or what
Yeah,
year was it?
99.
Right, right. So you might have symptoms that might be associated with so many other conditions, with common symptoms. You have nausea, you have tachycardia, maybe blood pressure, blood sugar dysregulation, fatigue. You have um, well, you could say it's beyond fatigue. And I know some people use the term chronic fatigue or what's the other one? Myoencephalitis,
Yes.
uh,
Um,
MCS, MFS. Which one is it? It's one of those acronyms. So with this, you can also have things like vascular compression issues. Some people get diagnosed with the condition POTS or orthostatic hypotension. Some people finally receive something akin to mast cell activation syndrome because that inflammation is systemic. It's not just localized. So if we don't find a way to tamp that reaction down, and some people are fortunate to be able to have an explant, but some people aren't. So you have to figure out what things you can do to reduce the whole body like reaction through
yes.
detoxification.
Yeah. You used a word there called, am I right in saying explant? Explant?
Yes,
What does
correct.
that mean?
An explant is the opposite. So it's when a surgeon can go in and
Okay.
do a full or partial removal. And that's the case more times than not. People can go in and do a partial removal, especially if you're not going to a hernia specialist or if someone familiar with breast implant illness, for instance, they only remove part of what is determined to be causing the problem. And so that won't solve the problem altogether because you still have something triggering your body, right? So with an explant, which I was fortunate to be able to have, it was a full removal. And again, mine was a biodegradable mesh, but it came out fully intact, with the exception of some of the edges that were fraying already. They were fraying, but it was more along the lines of the inflammation causing it to kind of contort within my body.
How would someone know whether their mesh years later is still intact? Would they have an x-ray, or like, how do they go if they're suspecting that they've got these symptoms, which was one of the things I was going to ask you. So I'm so glad that you've brought up the range of symptoms that someone can experience. So they may be experiencing all this, and they've started going down the path with a doctor, a functional doctor, or someone like yourself, and you've ruled out most of it, and so you're starting to explore the mesh implant. How do
Mhm.
you know whether it's fully intact or not to go down the path of having an operation?
Right. So most times, if it's not fully intact, there will be some chronic pain happening, and that could be due to mesh migration or like shrinkage of the mesh. So the symptoms will like highly be dependent I'm sorry, not the symptoms, but the diagnoses will be dependent on the symptoms. Of course, with that, if you don't have significant pain, then you have to rule everything else out, unfortunately. In the conventional medicine world, you probably do cardio, cardiovascular workups, you do neurology workups, and I've done them all. And gastrointestinal workups, they might do colonoscopies and endoscopies to make sure there's no structural damage. But they do see it. And unfortunately, there's a lot of bowel perforations that are happening with mesh, abdominal mesh. And on top of that, the sad thing is, and I probably had maybe 8 to 10 CAT scans my first year of having, even within the first 5 months of having the implant, because I had to keep going to the emergency room with severe symptoms. And the CAT scans, if you're not well versed in studying, or if you're not a radiologist that specializes in it, you're not going to be able to see or distinguish between the mesh and tissue or even like scar or adhesion. So my recommendation is always to seek out a hernia specialist, preferably before any operation, and not just go with a GP.
Yes. For our audience, what sort of symptoms did you experience?
Yeah, mine were very severe. And when you asked the question about how do you know, well,
Mm,
my reaction was immediate. From the moment I woke up from surgery, I felt off. Like
mm,
first, for lack of a better word, I was vomiting. I was very um, tachycardic at the time, and we couldn't understand why. It wasn't a normal response, is what they told me. But they said, 3 days, 5 days, a week, you should start feeling better. And that wasn't the case. So I had, again, severe nausea, unrelenting, a lot of head pressure, the worst, as if you had a migraine, an unending migraine, and there was nothing that I could do to tamp that pain. So I think that among those, and then the pain, because the inflammation started immediately, you have surgery, you're already inflamed, but there was nothing that they gave me pharmaceutical wise to bring down the pain, and that was kind of the the first thoughts that led me to believe my body's not processing these pharmaceuticals the way it's supposed to. It's either metabolizing it too quickly or it's just rejecting it altogether.
mm.
And that's what kind of led me to seek help from other hernia support groups that I found actually on Facebook. And that's where I really started digging into the research, like what could cause this? Is it really mesh that can cause it? Like even in that year, people were more suffering from the chronic pain part of it. So Asia syndrome now is becoming a term that's circulating within those groups because we're noticing all of these symptoms and like the gastrointestinal symptoms even that are correlating with when people have had mesh implants or if they've noticed structural changes in their abdomen, then those symptoms are starting to pick up more and more.
And is it sort of, we can't separate anything. Everything's, connected in the body.
Right.
Do you see more particular symptoms depending on where the mesh is? So, or is it just systemic? Like you have mesh in your body and you're just gonna have symptoms? Or do you, um, like if you have, like you were saying, if you have it in your abdomen, may have more gastrointestinal, or so. Do they use mesh with hernia like depending where your hernia is, it's always like that? Or is it more in areas that have more movement, like in the groin area or the stomach
Right.
always bending over? Is it?
So yeah, they do use mesh. Like I said, it's the gold standard. So they're
Mm,
going to use mesh with the exception of if the hernia is small enough and you're again going to a hernia specialist. Now I think that there's a cutoff between probably 2 millimeters, so it's not really that large, but they'll still use mesh. So if you go to a hernia specialist or an abdominal reconstructive, like a plastic surgeon, they
yeah,
could potentially bridge the abdominal hernias. Now, we're not talking about inguinal hernias, which is probably what you had, because it's more in the groin.
in the
But
groin.
any of the like umbilical, periumbilical, so in that region, or even some incisional hernias can be repaired like an abdominoplasty. So they can join the muscle layers together, like really suture up that hole and not leave it as an opening versus people who do an onlay of the mesh. They don't do anything to close the defect itself. They're just covering it with the mesh, and then the mesh is what's preventing the hernia from coming out again. But we know sometimes people reherniate either way.
Right. Okay. So that's almost like putting a band-aid on a cut.
Correct. Right.
Not the best
Right.
solution.
Not at all. No,
You
it
think
it
you're
doesn't
doing it,
fix.
You'll be sutured up when you have a hole in your body.
Right.
So, are doctors, well, hernia specialists, are they understanding that this is happening, or is it still not accepted as a reality for people?
Yeah, I think it's again the research is more and more prominent. Dr. Sharon Surita is actually one of the leading hernia specialists in the United States, and she's put out a couple of research papers that really dive into reactions, how people are reactive, and she goes into the symptomology. She also goes into recovery post explant, so we can see that these people who are having explants are recovering like pretty quickly. I don't remember if it was 6 weeks on, they're noticing significant improvement. And then, and that was a high percentage of the people having explants. So it's the evidence is there that the hernia, the mesh is implant, all of these symptoms occur. The mesh is explant, a lot of the symptoms clear up. And then over time, as people practice, the proper diet, the exercise or movement, the detoxification practices that you have to use daily, they can see more and more improvement, which was my case. It took many years to get to, pseudo functional again from being bed bound in the beginning of my illness.
Wow, bedbound. That
Mhm.
is extreme. That is extreme reaction, and I'm sure a lot of people have had it that just haven't put the two together. That's
Yeah.
the thing, it's joining the dots, and if you're not aware, it's so hard to actually join those dots.
Hmm.
So if the traditional way of doing it with mesh implant causes these symptoms, are there any new advancements? Is there any alternative that they're using that is better for people? Or do
Yeah,
you
the research
still,
continues.
they, we're
Yeah.
hopeful, are we?
Yes, I guess the phase 6 mesh, which I mentioned earlier, the hybrid and then the biologic mesh are more appropriate for people who, no, I won't say the phase 6. Let me take that one out of the mix. But biologic mesh is more appropriate for people who might already have autoimmune conditions. So that's something that should trigger people. Hey, I have reactions to certain things, or again, it's some type of condition where my body's attacking itself, or for lack of a better phrase. But if you already know you're hypersensitive to certain things, then having a prosthetic mesh implanted is not probably the best option for you. And it might be the only option if the hernia is large or too large, but it's something to consider and go forward with your surgeon and try to analyze what is the best course of action for each case.
Right. So in
Mhm.
some people's case, if the hernia is very large, what you're saying is just to suture it, just to stitch it up isn't
If it's
enough.
not large. Hmm.
Yeah, you actually need some form of other structural support, and that's why they use the mesh. But it's
Right.
about inquiring, now that we know this, is about inquiring what type of mesh that they're going to use. So this is
Right.
where this podcast, this episode is going to be so crucial for so many people because hernia is so common. It's not like, you can speak. I know so many, including myself, my brothers, friends, all have hernia.
Hmm.
So to actually be um, educated and aware before you actually go in, unlike you, you went, or you may have been aware, but you got something that you didn't want. I had no idea. I didn't even know that they were putting mesh in.
Hmm.
So, but now, that was 99. We're talking about 25 years later. The patient doctor communication has improved and people are a lot more aware. But what what can what can people experience? So what I want to know is if someone's had the operation and they experience a symptom, they can feel fairly confident that they can directly correlate that symptom to the mesh.
I would say it's a little more complicated than that because we talk about the toxin bucket overload. So in many people's cases, they might not have any symptoms initially. So they might have additional exposures like the people are having vaccine injuries now, that is actually tipping the bucket into what the dysautonomia world or mast cell world, where you're having a chronic disorder. But it can be a culmination of all of these toxins that a person is exposed to over the years. And I'm no exception. As I mentioned before, I was an engineer. I worked in the field. I was exposed to landfill gas. I was exposed to chemicals in the environmental lab. I was exposed to things as a consultant every time I took samples. Like, obviously, those are chronic exposures over time, but I wasn't ill at that time. So
Mm.
at that point, my body was still able to process these toxins out. And, obviously my liver was fully functioning. But as you age, unfortunately, those detox processes, like, you're just perpetually exposed to these toxins. And if you're not aware of what you can be doing to reduce exposures and also what you can do to better those detoxification processes, then there might be an incident or an event that is going to tip you over over the edge, or fill your bucket into full capacity.
Yes, yes. That is such a good point. And it is that fill the bucket. Like you've got to a certain point, and then the body goes, you know what? Not one bit more. Like,
Right.
I'm gonna let you know it's time to clean up, clean up the body. So you have, what is your point approach? You have a point approach to healing, and
Mhm.
especially from implant illness, and you are an expert in detoxification and toxicity. So, what is this point approach that you have?
So the point approach is looking at all of our functional pillars, and functional medicine practitioners all over the world do focus on certain pillars. One of them being, and I'll go through the acronym POINT. So P is proper nutrition. And the first thing is that we're not really eating according to our metabolic type if we're just trying to fit into whatever the fad diet is, or whatever, you know, if you want to increase mass, for instance, so you start bulking up by eating more protein, and that might not necessarily be according to your metabolic type. So
Yeah.
you're causing, like, either acidity or alkalinity in your body, where it's going to kind of affect the processes over time. So that's just one thing. Like, a proper nutrition is going to look at how your body is oxidizing, whether it be fast, slow, or mixed. And you want to eat according to that, in terms of macronutrients. But you also have to look at any food sensitivities. And for the chronic illness
Mm.
community, when we're thinking people who have been exposed, to numerous environmental toxins, who are suffering from mesh implant illness, you might have developed a lot of food sensitivities. You might not be able to process oxalates from your body anymore. Your liver is fully congested at this time. You probably had so many pharmaceutical products from surgery, anesthesia. You have probably multiple rounds of antibiotics, because we know that that's commonly prescribed as a preventative, unfortunately. It's not absolutely necessary, but in most cases, I've seen that those were prescribed alongside. So imagine that you're undergoing the anesthesia, you're in this traumatic surgery process. It's not an easy surgery, and your body, it's taking it as a pretty big trauma. So that, alongside any pain reliever medications, even if it's ibuprofen or any other non-inflammatory, or sorry, the NSAIDs, right? Or even Tylenol, high strength Tylenol, all of those have impacts to your organ systems, your elimination systems, we'll say, your kidneys, your liver, even your colon can be impacted. So when we think about nutrition, we want to look at all of this and try to eliminate any stressors that we can when it comes to the macronutrients and even the micronutrients that you're bringing in. So that is our P. O is for optimizing movement. And again, in most, if you're otherwise healthy, you can exercise traditionally. You can go, do weight training, you can do Pilates or anything like that. But unfortunately, people who are chronically ill from implant illness, they cannot do the traditional exercise. So you have to learn to optimize movement, find a form of movement that you can do to encourage, like, lymphatic drainage in the body. And movement is so fundamental for that. So whether it be, even if you're lying down, doing leg lifts or arm pumps, or you need a therapist to come in and help you get some movement, even at that point, start and wherever you can and work your way up. That's where I started. And then even a hand bike, I had a hand bike on the desk. And then I slowly moved into recumbent bike, where I started with a minute at a time, 2 minutes. It took
Yeah.
probably 3 months to get to a 20-minute mark. But finding that movement and continuing a practice that suits the person. So that
Yeah.
is our O. You want me to continue with the rest of
Yes.
point?
Yes, please.
Okay. So I is to identify all the stressors. And we kind of mentioned that with the dietary and the environmental
Mm.
toxins, but stress is beyond the physical as well. So we look at the physical component of it, because we can do so much to change the products that we use, minimize things with words that we can't pronounce, for instance, or artificial synthetic ingredients, fragrances, things that we're exposed to, especially when you put it on your skin. You're having it absorb through your skin. You're also inhaling any of the fragrance or those synthetics all day long. So think about cleaning out your personal care products, your cleaning products, and then your cookware. If you want to have an air filtration system, because we know indoor air is more than not more polluted than even outdoor air,
I
even
find that
in
one, when people say that, I find that so fascinating, that one. It's like what we're breathing inside is worse than being
Mhm.
outside with all the cars and all the environmental pollution. It's incredible, you know.
Right, right. But that's because of the dilution effect, right? Because
Mm,
outside, that's way more volume than you have inside your home. And with
mm,
the newer construction, everything is airtight, so you're not getting that proper ventilation. And then of course you have to worry about mold in places that are higher in humidity. So that's another piece. So
yes,
that's like we're looking at those physical stressors, but we also need to look at the emotional, mental, and spiritual stressors. And that emotional piece is a critical piece of healing for anyone with this type of disorder, because it's systemic again. And we get into that mindset that we're never going to heal, or we get into a mindset that these symptoms are just going to compound and compound. But
mm,
we have to learn to turn off the noise. And I always recommend brain retraining programs like the Gupta program to start, or maybe Primal Trust, which is another good one to help people kind of regulate that the mental response and do that neural retraining that's really fundamental to healing. So
yes, yeah. And that's one, what that was the I, so you got the N and the T left.
yes. Yeah. So N is to nurture sleep. And a lot of people think, oh, I sleep, 7 hours, 6 hours, I get enough sleep. And that is not the case. Like ideally, we want 7 to 8 hours of sleep. We want to be asleep between the hours of 10 p.m. and 6 a.m. if possible, because that's when most of our organ systems start detoxing while we're sleeping. And the rest, repair, restore phases are really ramping up. So we want to be sleeping at that time. And then the whole thing with sleep hygiene, we won't dive into that, because there's so many things that people can do, including, making sure EMFs are out of the room, and, adjusting the temperature to a cool setting. So many things that people can look at. You can even Google it and find some good tips, or you can go to resources that probably you provide and I provide, and just make that sleeping area a safe haven and somewhere you can really repair. And then the last one, of course, is the targeted therapies. So it's last for a reason, because we have to make all of those changes in our diet and lifestyle before we approach it with supplements and other targeted therapies, maybe some herbal recommendations. So from here, we use diagnostic labs. We are functional diagnostic nutrition practitioners. So we do an assortment of labs to really look to see where are the deficiencies, where are the imbalances, and from there, after people have implemented these lifestyle changes, we see what additional supports might be needed. And that's where supplementation comes in at the end.
Really, really important points that you've brought up, because you can't supplement yourself to better health if you don't do all the lifestyle changes. Like, you can't stay up late watching TV until 1 o'clock in the morning, get 4 hours sleep, you know,
Mhm.
drink considerable alcohol and all the rest of it, and then take your supplements to make yourself feel better. So that is I really love that point approach, because it's really kind of like a lifestyle medicine sort of approach to things. And for not to create fear in people who are listening to this, that they have implants, um, who maybe can't remove them. You know,
Mhm.
maybe their hernia has been too big and they require the mesh to be there. Or, you know, maybe they can't afford to have another operation. There is
That's
hope
right.
for them by applying what you've just said. So it's kind of like whether you've got the mesh in you or you choose to have it removed. Because I think that would be, once you've got all the scar tissue and everything around the mesh, that would be quite an intricate operation, would it not, removing it?
Yes,
Especially if it's
it does
been
take
in.
a lot longer.
Yeah. So there is hope by what it sounds like, applying very much the same methods that you would in life if you had an autoimmune or some other kind of chronic illness not related to mesh.
Right. Right,
Right.
absolutely.
Yeah.
With the mesh, again, with other implants too, people have valve implants for heart defects, and there might be joint repairs, and some of these things are not explantable, as you mentioned. So adjusting again your diet and lifestyle, and then supporting your body's needs it's a lifelong thing. So we're not going to do things for a month or 2 months and get back to where we were before. No, it's you want to do all of these things that are healthy for you and for you specifically. It's like a bio-individual approach, and then continue that on so that you live an optimal life, the better quality of life and functionality.
Absolutely. And one question actually just came to me now that I'd like to ask is, what's the chance of developing uh, bacteria or around these implants? Like you say, you've got an implant can be anything. It's from breast implants to a stent in your heart to mesh for hernias. We are specifically talking about mesh today, but let's just go a little bit into like other things like a hip replacement. They can all breed bacteria, can they not?
Hmm.
That then
Absolutely.
can grow and get into the blood.
Hmm. And it's usually in the form of biofilm, which are like colonies of bacteria that inhabit an area, especially when there's foreign responses happening, right? They're going to go to the source where the inflammation is happening, and they will colonize. So that is an issue, and biofilms are evident in mesh. They're evident in the breast implants, the silicone implants. And so we're thinking when we see anyone with these systemic things, it's part of the same kind of approach you would do for mold toxicity, where you have colonization there. You want to break apart those biofilms, flush them out of the body, but you'll have to do it continuously, like on a cycle, of course. You don't want to expose yourself to all these biofilm busters all the time, all the time. But you know that the likelihood of this happening, if your implant is not able to be removed, then you have to be more cautious, and you have to think about what things I can do to regulate the bacterial colonies in the entire body, not just in the gut microbiome, although that is one of the biggest pieces, but to think about all the microbiomes in the body, even if we're looking at the skin, we want to make sure that there's balance in every area of the body.
Absolutely. And you did touch on that is so important because I don't think any, I don't think many people think when someone goes, I'm in such terrible pain, I need a hip replacement, that what they're actually introducing into their body when they put a foreign element like that into their body, that you can have all that bacteria around it. Exactly the
Hmm.
same as the mesh, you know. So sometimes when you have infections or whatever, and you don't know where the sources come from, well, this is somewhere where you can start looking.
Hmm.
What advice can you give to someone around advocating for themselves prior to actually having the surgery?
Oh yes, this is so important. If you're able to do it, if it's not an emergent condition, then definitely get multiple opinions. Do not settle for the first one. Even if you feel confident with that one, make sure you get the knowledge of different procedures and how different practitioners are going to approach it. You
Yeah,
really want to find a hernia specialist or even any kind of reconstruction specialist that specializes and ask the questions like, have you experienced patients having, this Asia syndrome? Have you had to do explants? How many? And what kinds of materials do you use? Like, get all that information in there. And then another important piece, besides getting all the knowledge is to pre-tox. So prep your body. You shouldn't go in there with a diet full of processed carbs, processed sugars, and you want to amp your body up to get into that repair mode for it. So make sure you're eating clean. You start those detox practices before and get into the routine. Make it a part of your life so that your recovery process will be so much better.
That is great advice and I really do hope that many people, after listening to this and or contacting you, that they understand the importance of actually speaking up prior to actually accepting something into your body, because
Mhm.
the consequences can be huge, as you've experienced. Thank you so much, Dr. Sharon Surita, for coming on to the show. And if anybody would, is listening to this and they go, this is me, I'm experiencing this, I've had that operation, please, all of Dr. Sharon Surita's details will be in the show notes. Contact her. This isn't something you want to do on your own. You really need guided help, and she's here to do it. Thank you so much for being on the show.
Thank you so much, Rita. It was a pleasure.
Thank you. I would love to know, what was the biggest insight or aha moment you got from this interview, so you can now speak up, take action, and make informed decisions for your health. And if you like this episode, get instant access to your free ebook, Alternative Wisdom, Taking Back Control of Your Health, at life-onus.com.